really, this is what has spurred my interest in this arena was, as you know, I come from a state which was one of the first with Colorado to legalize marijuana. And what really became available to us was this idea that we could maybe actually learn more about it because our patients would be honest with us. But what struck me is that when legislators, not doctors, say that something's okay, it's legal, suddenly there's a perception that it is safe and maybe even good for you. And so this caused me to go to the library in my home, and I inherited this old Time Life series, with these pictures on the cover that my dad had given me. And I looked at this edition from 1965, and there's this picture of a surgeon standing outside he's literally outside the operating room. His mask is down. Of course, it's a man. And he's got a cigarette, I can't imagine the oxygen levels nearby, but either way. And it made me wonder, are we making the same mistakes of ignorance about cannabis as maybe we did about tobacco in the 1940s and 50s? So just a little different take on this. These are the things that I hope that you could do when I'm done talking. It's more fun facts than anything else. And while all of you may not practice in the realm of fertility, who sees patients for fertility concerns? A smaller percentage of you, but a little bit. Nonetheless, I think this makes for really interesting cocktail party talk. I had a patient. For most of my talks, I've introduced a patient, and this was a patient who walked in to see me sort of about his reproductive concerns and the fact that he and his partner had been trying for a while. And for years, I had always included in my health history, much like Dr. Terlicki, we give very regimented questionnaires to our patients, and we've always asked about cannabis as a putative risk factor for male fertility concerns. But it wasn't until it was really legalized in 2012 that I think I really started getting sincere answers. And it struck me that when I informed this patient in his counseling session that I thought maybe his 10-time daily use of cannabis could have a negative consequence, and his eyes were just like, "You're kidding me." And I said, well, let's talk more about it. And it turned out that, working with UW Media, he wound up kind of participating in the generation of an article. And this led to a lot of sequelae and a lot of interest just in the lay press around my neck of the woods. But I have some queries for you. What would you guess is the percentage of Americans who use cannabis with some regularity? You don't have to scream out your answer, but just keep your answer in your mind and we'll get to it as we go along. This is a recent download from Statista. For those of you who don't use these easily online available statistics, I love them. They're phenomenal. And I would point out that when I first put this talk together back in 2018, it was a different map. And it's almost better to look at the states where there's not some legal access to cannabis now. But the vast majority of states have legal access to cannabis, or there's either medical or recreational use. And if you're not in one of those states, you're next to one of those states. And so I know we get a lot of traffic from Idaho, despite their conservative approach. This is a slide that I actually downloaded back in 2018, and I kept it in this more modern deck because I thought it was quite fascinating at the projections from Forbes on growth of the cannabis industry in the US. And here we are in 2024. And I would ask you, does anyone want to throw out a number of what they think the industry is now in billions in 2024? Anybody want to throw out a number? I like it, 200. No, not quite 200, but it's about 45 billion. So it doubled again between 20 and 24. So it's about 45 billion is the estimate of the industry. So this is a massive industry, and I know we have a lot of international attendees. I don't want you to feel left out. It's a very dense bright red spot there in Europe. So Fiona, we know what's happening in Europe as well. The answer is that, if you look at utilization amongst people who say they use it rarely or every day, it's about 18% of the US population. So 1/5 of people use cannabis regularly. And so as a health concern, I think we have to be attentive to it. And I want to acknowledge there might be good health repercussions and there may be bad health repercussions, but I think it's our duty to understand the repercussions in our domain and to educate people because clearly they don't know. And why is, we have at least one child in the audience, I know. But this is what captured my attention as a parent. I'm the parent of 16-year-old twins. And I just want to point out to you this inflection point back in 2012 where more teenagers began using cannabis as compared to smoking cigarettes. And it's projected that these curves continue to diverge. And those vape units that are sold at the corner stores next to your local high school, they're using those not necessarily just to put bubbly fruit in. They also have tetrahydrocannabinol, which is the most common thing that affects what cannabis does. So would you say that support of marijuana legalization has plateaued, decreased, or increased? It's increased. It really has. And so you can see that, here, the 1960s, this was this really incredible liberal time in the US. But nonetheless, the support for the complete legalization of cannabis has really escalated. So I think we should all anticipate this to grow and grow and grow. And whether or not it would ever be federally legislated, I just don't know. This isn't intended to be a science-heavy lecture, but I think you have to understand, why does cannabis or THC have the impact on us that it does? Well, it's because we are loaded with cannabis receptors in our body. It's because we have endogenous cannabinoids. The primary cannabinoid in the human body is anandamide, and then the plant-derived cannabinoid is tetrahydrocannabinol, or THC. You've all heard this term. These receptors, which are 7 transmembrane G-coupled receptors, hearkening back to medical school and basic science, they release and sequester intracellular calcium, and this is the method by which they change intracellular transcription and have these immediate effects. But it's this idea that the affinity for these receptors for THC is so much stronger than our own endogenous receptors. And so when you get this bolus of THC, it's a really different impact on the human body. And don't stare too long at this, but this is my cue to tell you to transition to how this has an impact in the reproductive tract. And I'm going to really simplify this, which is the idea that sperm have receptors for THC or cannabinoid receptors on their surface. And then throughout the male reproductive tract and the female reproductive tract, there's an ever-changing gradient of endogenous cannabinoids. So there's this idea that men ejaculate sperm and there's a certain density of anandamide that's there binding these receptors. And then as that concentration gradient changes, when ejaculation occurs in the female reproductive tract, this change in gradient is hypothesized to guide the sperm to the egg, from the vagina into the fallopian tubes to the egg, and to cause hyperactivation. So I like to think of it as, when I get on the airplane, when I flew here on Alaska, it's like they always tell you about the lighted walkway, right? When the plane goes down, follow the lighted walkway. And I sort of think of this concentration gradient of cannabinoids as the lighted pathway. And imagine if the plane crashes, though, and the lighted walkway is so bright everywhere, you have nowhere to go. And that's kind of what happens if we overwhelm the system with cannabis in the man and in the woman. Does that make sense? Okay, all right. So But there was another thing that captured my interest about cannabis, and I was attending an American Society of Reproductive Medicine meeting, it must have been almost 7 years ago. And I attended a contraceptive session, and there was a group out of Europe that had essentially developed a hypercharged cannabinoid-like molecule that they were using as a potential non-hormonal contraceptive agent because it was so powerful in inhibiting sperm production. I thought, oh my gosh, this is really amazing stuff. So the question has been posed, how has marijuana or cannabis been implicated in actual semen quality? And I'll let you read through this and maybe you can answer it at the end. But these are all the major WHO parameters. And this is just a quick exhibit of some data that was out there when we began to think about this. This comes from the United Kingdom from a group led by Pacey. This is from 14 reproductive clinics. You can't read this, but what it essentially says is that in this reproductive age group, there's a 2 to 3-fold increased risk of having abnormal sperm morphology associated with chronic cannabis use. And subsequent to this, a number of different papers have come out in various populations, all from Europe, I would point out. One from the UK, one from Denmark. Denmark does a phenomenal job of tracking parameters amongst their entire population, but specifically conscripts into the military, which is mandatory service. And they, how lovely that they get ejaculates on these guys and measure their semen quality too. I mean, we should do that here in the US. But it all paints a picture of a decline in semen quality beyond just this idea of a decline in fertility. And so we were really curious about our own backyard. And so we did a quick, less than a year-long prospective evaluation of semen quality in our patients. As you know, as I mentioned to you, marijuana was legalized on December 6th of 2012 in Washington State, and we began collecting data 5 years after that. Amongst we have this very specified questionnaire when men report to our center. We're very lucky in that we run our own lab, our own clinical lab. And I want to point out that we really have no idea how to quantify cannabis use. And this is a challenge. So we were very rudimentary. We just said, never, they turned the lights off on me. I'm sorry, I'll move fast. Do you guys mind if I keep talking? Okay. Oh, you didn't turn the lights off on me. Okay. And so we really had ever, never, current, and past, which we have to get better than that. We have to quantify it, but I still don't know how to quantify it. If you know how to quantify it, let's talk afterwards. And this is essentially what we did. So we had about 400 men that we got this prospective data on. Not to my surprise, almost half of our patients presenting for reproductive evaluation are cannabis users. They use it routinely. And it's really interesting to hear all the different reasons. Some are recreational, some for sleep, some it helps their irritable bowel. It obviously has very good medicinal effects as well. And what we chose to do in modeling this data, which was novel, is we said, what are just the odds that they fall outside the WHO's, the World Health Organization's normal criteria? And what we found was, a few things. Number one was that, and again, I want to just point out how we should interpret odds ratios. I want you to focus on that column that says odds ratio. And you'll see that consistently in the two groups, men who were chronic cannabis users had a 2-fold increase their odds of having an abnormal shape to their sperm or abnormal morphology. But there were some things that were surprising and that I don't know if are meaningful. Like we saw differences in volume in those who were current versus past users. And I don't have a clinical belief in that, so I'm going to toss that one out. But I thought it was also very interesting, this notion that cannabis seemed to make sperm more motile. But I want to hearken back briefly to that data that I shared you with the crazy graphs showing these concentration gradients. And it turns out that when you expose semen to this high dose of THC, you might be causing the sperm to hyperactivate. So this may be a very believable finding. We may be causing sperm to sort of, blow their, they may be kind of hypercharging themselves prematurely before they get to the egg. So this may be a real problem. I was thinking about how I could stumble over my words there. So our data, seem to support this idea that there is an impact on semen quality. So just to summarize what I've said to you, I think there's clear evidence that the use of cannabis in the US and elsewhere is really increasing. And I just want to emphasize, I think it's on us to ask some questions. I don't think we should follow the path of our predecessors. I don't want to be looking at a Time Life well, we won't be looking at any magazines, but I don't want to have this regret that we allowed people to think something was good or safe when maybe it wasn't. There's clearly evidence that chronic cannabis use has an impact on reproductive health. I also just want to point out data that's come out of my institution that really suggests that chronic cannabis use may pose a heightened risk for testis cancer, and I think that literature is fairly robust now. It's clearly modulated by many factors. I think one person could use cannabis and it will have a profound effect, and another person could use it and it will have no effect, and that should not dissuade us in how we counsel our patients. And I think the verdict is really out on, when does the effect of cannabis stop? Does it ever stop? It may not. It may have some genetic effects that are far more prolonged. We just don't know. But I think amongst my couples who I see for reproductive health counseling, the easy button for me is just to say, hey, there's pretty good evidence that this could be negatively consequential for both of you to be using. So it might be time to stop while you're planning your family. All right. Like all things, takes a team. These are all the people that run our lab, prior fellows who I'm really proud of how they contributed to this, and all of our techs who, they just love doing this kind of research, and a lot of fun. And then I want to provide a shameless plug. I realized yesterday as I was listening to Jesse's talk, and I want to say that I love listening to Jesse talk because he always changes the way I think about things. But a couple years back, Joe Alukal and I put together a book about a lot of these topics. That's really a more academic book, but it doesn't really read like an academic book. And I just want to put it up here for all of you. And it includes all the things for those of you who are interested in men's health, sort of a cross-disciplinary thing. Like, what are the things that we can counsel our patients about mental health, GI health, dermatologic health, things like that. I was surprised that in Jesse's talk, he didn't talk about the use of retinoic acid, which is a clear anti-aging thing. But all of that is included in this book. So if you're looking for a quick way to learn some of these things, either for yourself or patients, this is a great, quick read. I'm a crappy editor, but Joe Alukal is a phenomenal editor, so it's a nice read, and you can get it on Amazon. Thanks for the shameless plug.
Thank you.
Okay, all right.
Thank you.